So hello everyone, welcome to our second Zoom meeting of our program. We're all really excited to have you guys again. Today we have Dr. Darshan Shah. He's a graduate from Edward via College of Osteopathic Medicine. College of Osteopathic Medicine. He's a newly minted intern at Penn State Hershey and will be completing his PM&R residency by 2020. So, Doctor, would you like to talk about yourself?
Yeah, absolutely. Yeah. First of all, thank you so much for having me on here. I mean, it's an honor to honestly be on here and, speak to 35 people. And I think you said you had 80. So you guys are doing a fantastic job, especially during COVID, where I think we're all trying to do our part and all trying to just help pre-meds and med students out there. Because these are just unprecedented times. And, anything small can turn to big. And that's just awesome what you guys are doing. So thanks for having me on here for sure. So that was a nice introduction. Thank you. So my name is Dr. Darsh. Everyone just calls me Darsh. You guys can leave the doctor, trust me. My goal for here is to be a very chill conversation, very enjoyable. I kind of have three goals. So the first goal is, for those of you interested in medicine, hopefully I can inspire you to stay on the path and choose medicine. The second goal is for those of you out there who are still pursuing medicine to possibly say, hey, medicine might not be the right field for me. And then the third goal is for those of you that are kind of in between after this discussion here, do I want to pursue medicine? Do I not? You can feel free to message me on Instagram or wherever and we can talk about it. But my job here, I think, is to really open your guys' perspectives and eyes open to what medicine truly is, as well as what it may not be. And so I'll definitely go into kind of my backstory of everything. So let's just kind of start there. So kind of growing up, I was always an athlete and I was always a book nerd. Right? So I think many people in medicine can kind of relate to one of those where it's we're studying, we're doing well. And, maybe we love the sciences or the maths. And then there's also people who kind of just stumble upon it, love helping people, understanding that they want to be in a life full of service. So for me, it was kind of a combination of those things. But when I actually applied to college, I actually realized maybe I wanted to do dentistry because my older brother's a dentist. And I had an interesting opportunity at the University of Pittsburgh Healthcare Scholars Academy, which is pretty much just an academy where you get healthcare exposure. And I was working on a mannequin and was giving an amalgam in the tooth. And I saw, wow, dentistry is awesome. This is maybe something I could do for the rest of my life. But I was only fooling around with myself, tricking myself into thinking, man, dentistry is the better option, as they say in medicine, because you have better lifestyle and you make just as good money. But that's not the reason why we choose it, right? We choose medicine because of our passion for understanding the human body and the people you meet and so on and so on. So essentially out of high school, I was thinking dentistry. And so I applied to 7-year program. So just like how there's a BSMD or a BSDO, they also have 7-year dental programs. Finally, I was accepted to one at Temple University. And then during my first semester at Temple University, I took a hard look at myself and just said, is dentistry really what I want to pursue? Or am I just, kidding around with myself? And I was kidding around. And after that first semester, I said, I don't want only an oral cavity approach. I want something more full body. I was very into athletics. I had a very good understanding of MSK. When people talk about there's 9 intelligences out there, right? Music, engineering, things like that. For me, it was very MSK. I understood how the body worked. And so I kind of just went ahead and pursued that. I said, you know what? I'm going to switch to go into medicine. So I switched into the 7-year medicine program at Temple University. Going through that, the requirements were a 3.5 GPA and at least of a 30 MCAT, which I think translates now to about a 508. So going through that, I missed the GPA cutoff by 0.02. So I ended up with a 3.48 science GPA, 3.56 overall, and I reached the MCAT. So in the end, it was kind of like, well, what do I do? This was reality. I went in thinking I was going to become a doctor. In high school, ever since I was young, I thought I was going to become a doctor. And here we are, my dreams kind of shattered, or not understanding, wait, I actually have to apply out. I thought I was guaranteed. And, a lot of emotions and things coming along with that, especially when your whole family and families know that, hey, this guy's in a 7-year med program, he's going to become a doctor. Well, now that 100% chance of becoming a doctor kind of just dropped way down. So those were kind of the things that were challenging for me. And like the reason why I didn't meet that GPA was because I honestly had no idea how to study in college. Like I had zero idea. High school was easy for me because I could just do the homework, and the homework was practice. And if I just did the homework, I was good for the exam. But in college, at least at Temple, there was barely any homework. It was more of a, you do it yourself and you learn yourself. And if you need help, you reach out. And I just didn't know how to navigate through that type of culture. So my GPA suffered definitely because of that. And so I was forced to take a gap year, at least one. So I applied in my junior year still. I took my MCAT after sophomore year. I front-loaded all my sciences in college. So I had my MCAT score of 30. I had my 3.48 GPA. And I said, you know what? I'm just going to apply after junior year and hopefully not take a gap year. Didn't get in, had a couple interviews here and there from DO as well, but didn't get in. So I said, okay, I have to take a gap year. What do I do? So this is when scribing really became a big hit. I think everyone nowadays knows what scribing is and actually tries to scribe. But back then, and again, I'm 28, so I'm talking about 8 years ago when I'm 20. Not many people scribed. So it was really a good opportunity to get it on your resume and differentiate yourself from other applicants. So I ended up applying for Scribe America, got the job, and I was in the CHOP network and I was doing pediatric ER scribing. So I did that for about 9 months. And I said, all right, this is cool. Like I'm learning medical terminology. I'm getting a behind the scenes look at how doctors interact with nurses and how they interact with techs, and something that you don't really get to see often. So it was a cool experience, but after a while, the learning curve is very steep, but then you start to plateau when you're a scribe. So I said, you know what? I have to find something else. And I stumbled across a quote that I was using in my personal statements. And it's a quote by Robert II. And he says, don't be afraid to walk away from something that no longer serves you, grows you, or makes you happy. So again, don't be afraid to walk away from something that no longer serves you, grows you, or makes you happy. That experience scribing was no longer serving me and I was no longer growing. There was no more information that I could have learned. So I said, all right, I got to get out of here and kind of find something else. Then I stumbled upon becoming a virology lab technician at a pharmaceutical company, kind of doing outsourcing. So drug companies make their vaccines, they send it to us. I'm pretty much the lab rat looking to see if there's any pathology and stuff like that. Again, I did that for 9 months. And the reason I stopped was going back to that quote. It was no longer serving me. Sure, I was making money. I got to experience what it's like to work in a real work environment with real work politics, with real bosses and stuff. And that's something that you really don't get in medical school or pre-med until you're a resident. And even when you're a resident, it's very different. So very grateful to have that experience when I was in a work environment as a super naive pre-med, not realizing what are the things you can talk about in the workplace, how do you act in a workplace, things like that. So after 9 months stint at this place, I applied again. So this is my second time applying. And again, I didn't get in, got less interviews actually than my first time applying. So I said, man, what am I lacking or what do I have to do? During undergrad, I did research. I wasn't published at the time from that research, but I did do a year's worth of research. I got a distinction in biology, which you can only get from Temple if you do a year's worth of research, write a paper on it, get submitted, and they approve. So I thought I had the research, but I thought, you know what? I never took biochem because it wasn't required. And maybe I'm lacking in research. Maybe schools need to see more of that from me because my GPA is low and my MCAT is, sure, solid, but not, stellar. So I said, okay, I'm going to have to find exercise physiology research because in my plan, I was thinking of a plan B. I was saying, if I can't get into med school this third time, my MCAT is going to expire and I need to figure out, am I going to take the MCAT again or do I move on to a plan B? And whatever that plan B was. For me at the time, it was getting a master's in exercise physiology and maybe working in a lab or kind of just doing like functional medicine stuff with exercise science. So I said, why not find something, exercise physio research that could help me with both paths. So I literally went out and I emailed people from Boston, from New York, from New Jersey, from Pennsylvania, from DC. I probably emailed over like 80 people. Finally, one got back to me and said, yeah, call. So I called for 2 weeks. I didn't hear anything. And I was thinking, I don't know what I'm going to do. Like, I don't want to go work. I don't want to do scribing. I want to do something more significant and diverse to help my resume out. And finally I called and she answers. And I was just like, man, I don't even know what to say now because I wasn't even expecting her to answer. She says, why don't you come in to UPenn? So she was a lab researcher at UPenn. I said, okay, yeah, sure. So I go in and immediately they're like, all right, we looked at your resume. We like your vibe. We think you're going to be a good fit. Do you just want to start Monday? And mind you, this is completely free. I said, I will, you don't have to pay me a dime. I will do free research for you because I knew she was a big name. If you go on breastcancer.org, her name is up everywhere in all the publications. I said, I will do anything just to be part of this lab. So I was part of that lab. And that's where I really learned how important it is to have mentors and how important it is to make connections and how important it is to let yourself say you'll do something even when you have zero experience behind it. And so what I mean by that is I never wrote an abstract, but they always asked me, the team of the lab saying, hey, do you want to do your own little research project and present it at the big conference in Maryland? And I said, yeah, sure, let's do it. So I learned how to do an abstract. I learned stat analysis, and then I learned how to present and be more eloquent with my voice. So that kind of really helped me out. And that third time I applied to VCOM, which I never did in the previous two. And again, let me backtrack. During my second application, I applied to VCOM. And so, hold on, let me get this straight because there's a lot of applications going on here. Yes, okay, so during my second, I applied to VCOM, I got an interview, I went and interviewed, and they ended up waitlisting me. So the issue with VCOM, and guys, if you're applying this cycle, make sure you check your junk email. Because VCOM sent me a secondary application, and by this time it's like November or December, and I'm like, I email them back and say like, hey, I know I'm a good fit for you guys, but I haven't gotten a secondary yet. And they're like, have you checked your junk? And I'm like, checking it, I don't see it. And I go back all the way and it's all the way in my junk from September. And I say, man, I'm so sorry. I didn't realize it was in there. They're like, no worries. So I submitted it real quickly. They gave me an interview a week later. So I interviewed there in about February or March. It was kind of late. So they were like, all right, we're going to waitlist you. The best part about VCOM though, is that if you get waitlisted there, you're pretty much guaranteed a seat in the next cycle. So I already knew I had an acceptance if I just had one more gap year, right? So that's kind of where that second gap year came, where I was doing research and stuff. So essentially I got into VCOM. I was doing the research just in case, because I didn't know if I was going to get in or not. And then so I kind of did that for 9 months as well. And then essentially went into VCOM, 4 years of medical school, obviously. I thought I was going to do maybe something internal medicine. I really enjoyed GI. But then I realized internal medicine, the type of medicine that was being practiced wasn't for me. I'm very into lifestyle medicine, functional medicine, integrated medicine. And so I thought, what's the best approach for me to get there, right? Because integrated and functional medicine is not a residency you can do. It's now a fellowship, but you still have to get some sort of basic training in one of the specialties that we had. So I chose PM&R because I said, hey, I'm really interested, I'm really into procedures. I'm really interested in motivating patients, being a mentor for patients. The patient population you work with is just amazing. And so now my goals are, so obviously applied, I got into a PM&R residency. I'm at Penn State Hershey doing my intern year. So the way PM&R works is you do 1 year of intern year and then you do 3 years of PM&R. And so I got lucky and I'm doing all 4 of those years here at Penn State Hershey. And then my future goals are essentially to practice functional medicine along with regenerative medicine, and doing a lot more procedures with stem cells and PRP and things of those nature. That's kind of my story from how I got to high school and thinking of medicine to where I am now. A lot of the details, that I could be talking about as well here is personal development and how I really got into that. And so essentially, I tell people on my TikTok or Instagram, whenever I go live, I could be the biggest spokesperson for taking gap year. Gap year is crucial in my opinion. I think it should almost be mandated by every med school, because if you talk to most residents, you ask them, hey, how'd you do in medical school? The ones that tell you, hey, I had a really good work-life balance. I figured it out. I understood this was more of a career than school. Those are the ones that are most likely taking a gap year. The ones that struggle a bit with the mentality of, hey, this is more of a career, not school, staying on top of things, understanding that you have to have a work-life balance, the burnout, most often those are the students that are going straight in. It's not always the case, of course, but generally when I talk to people on Instagram and I've done collaborations with people, and this is one topic I always bring up is, hey, gap year or not, and what you do and what you learn from it. That's one of the things I often learn. And so the reason I really say gap year is, one, you really get to choose whether medicine is for you or not. I think when we are high schoolers or pre-med in college, we get sucked into this idea of medicine, and based on our personality, the way we are, we're very type A, and we feel like if we don't do whatever we set our minds to, we almost become a failure. And because of that, if you choose something outside of medicine, you almost feel like you failed. So you kind of just push yourself through that with blinders and not thinking about other perspectives or other fields out there. Second thing is, you really need a mature mindset going into medical school. So what I mean by that is, again, understanding that school, like med school, is not really school anymore. It's your career. It's what you're going to be doing for the rest of your life. You can chase grades, you can chase scores, but med school is not really about that. It's more about enjoying the process, learning, and making the connections that you need to, and just understanding what it takes to become a doctor more than it is the scores. And I think that's the issue is in undergrad, you're chasing a 4.0. In MCAT, you're chasing I don't even know what the highest score is now, 528 or 530. You're chasing numbers. But when you get to med school, a lot of schools are pass-fail. So it makes it a little bit of an easier time to say, hey, I just got to get through. And then with board scores, of course, you will always want to achieve the highest board score you can get. But if you know you want to do family medicine, for example, there's no point trying to get a 260 when you can just get a 230 or 235 and then take that extra time when you're not studying and put it into research, put it into reading, put it into working out, put it into the things that you love to do. So that's essentially like the second reason. And then the third reason is you really get the chance to hone your skills. So whether it's communication, whether it's, again, learning how to work in a work environment, which was crucial for me. And then I really got to pick up, reading again and understanding what it means to read and develop yourself. So you really get those options when you take those gap years. And, I wasn't planning on taking gap years. And now I look back and I tell everyone, like, those 2 years single-handedly changed my life and my whole path of life in med school and beyond. So it's been an interesting journey. It's been journeys of up and down, but that is medicine for you. I mean, it's the biggest thing I learned on this journey is that you really never know where it's going to go. You can expect one thing and then something else happens, right? And that's exactly what's going to happen with your patients. You expect your patient to be completely fine. The next thing you know, they have SVT and they start crashing. And it's all about adjusting and taking control of your emotions and controlling the things that you can control. And when you can do those things, you're really in the driver's seat, but understanding, hey, I'm in the driver's seat. I might be getting shaken on this roller coaster, but at least I can control what I can control and I can get to the destination I need to be at. It's about enjoying that roller coaster ride, right? More than just finishing it, unless you're very scared, but at the same time. Yeah.
Thank you, Dr. Darsh, for that interesting story and your life lesson. Thank you for that. And now we're opening the way for any questions you may have. You may put it in the chat window, or you can actually unmute yourself and say it to Dr. Darsh directly. So this is the time to do so accordingly.
Yeah, absolutely. I don't bite, so ask away. I want to make this fun as well. So how do you keep the motivation to get into medical school? Okay, yeah, here we go. They're flying in. This is like me doing an Instagram live. How do you keep the motivation? Right, so the motivation comes down to your why, right? So like when you write your personal statement and things like that, it comes down to your biggest why. Like, what is the reason for you wanting to do medicine, right? And I think when you look on social media, too much of it is glamorized, right? I'm wearing figs. Yeah, you get to be a fashion model when you go into med school and stuff, right? So these are the things that, like, sure, come along with it, but these are the things that are not going to make you happy. You have to realize, when I'm a doctor, what are those things I'm going to do? What kept me motivated, honestly, was that quote. Don't be afraid to walk away from something that no longer serves you, grows you, or makes you happy. In medicine, I will always be served. In medicine, I'll always be growing. And in medicine, I'll always be happy. But the same goes for my patients. My patients will be served. I'm going to help my patients grow, and I'm going to help my patients be happy as well. So, that quote really opened up things for me and saying, I can't think of any other field where I can get complacent. And for me, learning and growing is everything. I'm constantly reading journal articles. I'm constantly just trying to flood my mind with information and perspectives, just so like I can enjoy life more, right? Life is more enjoyable when you can get that feeling of ecstasy. And that's done through education and knowledge. And so with medicine, that's just one thing that you'll keep growing. And that's where my motivation really came from. What exactly is PM&R? Yeah, good question. So PM&R is a very non-spoken field for some reason. In medical school, you learn absolutely nothing about it. But it stands for physical medicine and rehabilitation. So essentially, you're a rehab doctor. There's inpatient, there's outpatient. So the inpatient side of things deals with brain injuries, spinal cord, stroke patients, and then general rehab. And so these patients undergo some sort of whatever, a brain injury or spinal cord injury. How can they get back to living a functional life? How can they optimize their life? And someone needs to manage their medical symptoms as they're going through this therapy and rehab in the hospital, right? Somebody with spinal cord might have an injured bladder. They might defecate without knowing. They can get something called autonomic dysreflexia. So there's a lot of these complications that can happen. So you need a trained medical physician to take care of those complications. So that's kind of the inpatient side. And then outpatient with PM&R is more like sports medicine. You can do neuro rehab. You can do cancer rehab. You can do sports and spine. You can do pain medicine. You can do regenerative medicine, which is what I'm thinking of doing. So there's definitely a whole variety and diverse set of things you can do with PM&R. And that's why I fell in love with the field, is that you can really take different parts of it, mesh it together, and kind of just create your own field. And a lot of it is clinic. A lot of it can be procedure-based, but at the same time, you combine the two. So that's essentially what PM&R is. What do you find most challenging in your journey through medical school? Yeah, so this kind of leads me into one of my other pieces of advice. I think the biggest struggle for a lot of people in medical school is not comparing yourself to others. I think this, like, I never used to do that, even in like college, until you get to med school, because now you're with the top 1% of people, right? And you're thinking, hey, am I cut out for this? Like, man, I didn't do well in this exam and everyone else did well. So a lot of pre-meds, even in undergrad and high school, may have this where they are always comparing themselves with others and realizing, hey, I might not be good enough. And the biggest thing I can tell you is you have to stay on your own path. Remember that everyone has their own circumstances. Everyone has their own situations. For me, I was really into balancing my lifestyle in medical school. I had to work out. I wanted to learn like Spanish on the daily. I wanted to read on the daily. I wanted to practice mindfulness on the daily. So these were important things to me. And then I had a fiance too. So I knew I had to keep that going. For other people, they may not have those things. Maybe they're single. Maybe they have a family. Maybe they have a dog to take care of. Maybe they need to get a 260 on the boards in order to go into whatever they want to go to. So everyone has their own circumstances and situation. And just remember, even when you get into medical school or undergrad, you guys will not all be practicing the same type of medicine. Not everyone's going to go into internal medicine. Not everyone's out of those like 60% of people that do go into internal medicine, not everyone's going to the same program, right? So it's very important to keep in mind that all of your paths will diverge at some point. It may seem very together right now, but keep in mind in the future, like you guys will be very separate from one another, whoever you're comparing yourself to. So there's no point in honestly comparing yourself. It just makes you feel worse. So just remember, you have your strengths, you have your weaknesses. So I always say, double down on your strengths and focus on your weaknesses. I was very good at MSK. I sucked at neuro. My friend, very good at neuro, sucked at MSK. So there's a balance. You're going to be good at something. How do you know medicine was for you? I don't know. I mean, I just growing up, I always fell in love with the human body and like optimization. And I think I found the answer, honestly, maybe like between my 3rd and 4th year of med school. For me, I'm all about efficiency and effectiveness, whether it comes to the business side of the world, entrepreneurial side, whether it comes to me studying, whether it comes to the human body. I'm all about how can we make life more efficient and effective, because if you can do that, you enjoy it more, you can experience more of it. So for me as an athlete, I always try to see how can I make myself better than the rest of the people on the baseball field, the basketball court, the tennis court, or whatever it was. And so I looked at it from a MSK perspective, of a body perspective, and saying, okay, I can jump higher, I can build these muscles or this muscle or that. So I looked at it very biohacking wise, now I essentially, take supplements that I need to. I look at biohacking. I look at how can I optimize my body? Like I just bought a Whoop, just so I can figure out, hey, how my heart rate is, and the days I need to train harder. And for me, if I can ensure that in other people, then I'm doing my job in terms of motivating and doing lifestyle kind of hacks for people. Because in the end, my goal now is not to be part of a sick care system, but actually a healthcare system. And right now, the US is very much in a sick care system. We treat people who are sick, they leave sick, they come back sicker. And so I really want to be part of that solution, doing functional medicine.
Hi, Dr. Darshan. Sorry, I was wondering if I could ask you a question. So I was wondering, like, how are you able to manage just like more of the life aspects, like your relationships, like working out, just kind of like other sideline things besides med school?
Yeah, absolutely. For me, I've always been a kind of guy where I never really found much joy in getting the best scores and getting the best grades, because I knew like the marrow in life came from what you did on the day-to-day. And I really look at everything as, how can I take advantage of this situation?
PM&R resident. Show me.
So I always look at each situation, what can I do differently? And for me, I knew 90% of med students didn't have this work-life balance or didn't enjoy these things. So how can I separate myself? Okay, that was through trading on Instagram and becoming a pre-med mentor, med school mentor. That was for me learning Spanish, because if I can show Spanish in the clinical setting, I'm more likely to get like matched or look better. If I can read more books and gain more knowledge, then I'm more likely to apply those things. So I really much look at the non-objective kind of data and really focus on that. There's a book called The One Thing, which I really love, and I recommend. It's actually on my TikTok that I put for every pre-med to read. It's essentially about focusing on the one thing that you need to do that day for about 4 or 5 hours that will help you set up the rest of your life or the rest of your week or for whatever project you're dealing with. And for me, I realized you use a lot of your willpower in the morning. So if I woke up and I studied in med school, I would be less likely to do the things I love, like working out, reading, all those things later in the day, because I thought, oh, I'm done for the day. But if I did those things first thing when I woke up, I ate a healthy breakfast, I worked out, I read, I did all these things. And then let's say it's like 6 p.m. and I have 4 lectures to do. Well, I'm not going to skip on those lectures because I know I'm in med school. I know I have to get those lectures done in order to stay in med school. So I kind of, it's almost like tricking your brain into realizing like, this thing has to get done. So I'm going to save it for later because now I can focus on other things. I know I'm not going to let go of these things. Did I get the best grades? No. Did I get the best board scores? Absolutely not. Was I happy and content in med school? Yes. So that's essentially my mentality for med school, was kind of just, how can I have both? Okay, here it says, what would you say to someone who's deciding between doctor, NP, and PA? Yeah, it's a good question. I get that question oftentimes. Really comes down to understanding what are the things you can live with and what are the things you can't live without with, right? So if you cannot live without having a boss, then maybe you have to do medicine. If you can live with making less than 120K and you're okay with that, then NP and PA are on the table. If you're not okay with, the work-life balance and going through school for 8+ years, then doctor's off the table. So you really have to make a list in terms of what are the things that you cannot live without, and you got to start crossing things off. And then you have to see what are the things you can compromise and what are those things you enjoy. So once you make that list, you can really start to see, hey, I think PA actually might be the best choice instead of a doctor because of these things. So it's going to be a tough choice, but you really, really have, that's what I tell honestly everyone who reaches out to me, is you have to make that list and just really see. What study tips do you recommend for undergrad students? Oh man, I don't know if I'm the best person to ask because, as I shared, I didn't really study in undergrad. But if I could go back, honestly, I think the biggest, I tutor boards now. I tutor USMLE and ComLess. It's about learning the concepts and being able to teach it to someone. So if you can really synthesize the information and teach it to your roommate or teach it to like a 5-year-old, that essentially means that you've learned what it is at hand. The other thing I would do is create visual mnemonics. So create crazy stories, create like, things in your head that you can't forget. This works really good for like factoids, but it's been proven humans study best as visual learners. There's a book called Moonwalking with Einstein. If you guys have any free time, which I don't know if you do, it's a good book to read. And really just delves into that. So that's honestly the main thing I recommend. A lot of people talk about Anki. Anki is honestly really good if you're in a course for like 6 months or longer, maybe a year, because you really need that much time in order for the cards to really like set in and work. So it really works well in med school. I don't know how much in undergrad though. Was there a defining moment that made you want to pursue medicine? Honestly, no. There was never one defining moment where I was like, that's it. No, there wasn't. I think just growing up, I was always good at math, science. I was into math and science, and for that reason, I kind of just went with the flow. It's funny though, right? So like being brown, a lot of people think like, oh, did my parents force me to go to medical school? And my dad has always told me, why haven't you thought of business? Like, why don't you go down the business route? Every one of us Indians go into medicine, and I always was like, no, I can't stand business. Like, it's not for me. And now looking back, this is also one of my biggest pieces of advice. I wish I majored in econ. So if I would highly recommend not to major in biology, chemistry, biochem, any of the sciences, unless you're absolutely in love with it, which I don't know how many people are. But I would much rather major in something that you're never going to learn for the rest of your life. So when you think about like, if you're going to medical school, you're going to deal with the sciences for the rest of your life. You'll never, ever get a chance to go back and learn econ in depth or philosophy in depth or art in depth or engineering, computer science, whatever it is, whatever those other interests are. So I highly recommend, using these 4 years, 5 years of college and just exploring another field. And the reason I say that too is like, what if medicine actually wasn't your passion? You fell in love with something else. Or what if it reconfirmed your belief that, hey, I really want to do medicine, but hey, maybe this econ kind of helped me in terms of business sense. Med schools do not look down upon people who are non-science majors. And honestly, nothing you will learn in your science majors will help you in med school. None of it. It's just a whole different ballgame in med school. You're learning different things. You're learning things in a very human, anatomical way, physiology way. So that's why I say that. Don't be afraid to change your major. Honestly, if I could go back, I would have. But I wasn't allowed to as a 7-year pre-med. I had to stay biochem or biochem. But if I had the option, I would have changed it. What do you recommend doing in a, there's one. What's the difference between MD and DO? Yeah, so the main difference is that DOs, doctors of osteopathic medicine, have training in something called OMM, osteopathic manipulative medicine. Essentially what that means is we can treat certain pathologies, diagnoses, certain things with our hands. So my family loves to see me because I can always crack their back, and they just get a great release. So things like that, where we can treat like sinus issues, gut issues, kind of like musculoskeletal issues. So we're affecting the body externally, hoping that the internal organs can also like reset as well. So there's certain things we learn. We have about 250 plus hours, depending on the school, of labs where we're learning how to use our hands to really adjust things. So it's in between like a chiropractor and a masseuse, but then there's more like science and medical stuff involved in it. Other than that, there's no difference at all between the MD and DO. DOs can do surgery, DOs can do clinic, DOs can do everything the MD can. They do it all the competitive specialties, although it's a lot tougher. So yeah. What do you recommend doing during gap year? Honestly, it's up to you. I mean, I would look at your resume and maybe see two things. One, what are you really passionate about? And then two, what is it that you're lacking? So if you're lacking research, maybe do some research you enjoy. If you don't have much clinical experience, become a scribe. But honestly, you can even do something that's non-related to medicine. You can work for an investment banking firm. You can honestly, you can do whatever you want. On the side, I was a Lyft driver during my gap years, and I enjoyed that immensely. I think it really helped with how I spoke and just learning from different people. So You can honestly do anything. There's no right or wrong. What were some of the things that helped you stand out and get selected for the Temple 7-year dentistry program? Yeah, so I think it was mainly just my high school stats. I got 2140 SAT, my GPA, I don't know what it was, weighted or unweighted, but I was ranked 19 out of 1,054. And again, this is not for me to like brag or anything. This is just, I think it was honestly the stats. And I think when you're looking for a 7-year BSMD or a 7-year dental program, they're mainly going to look at your stats. How many AP classes did you take? How well did you do on those? And then they're going to look at your essays as well, and just see kind of how you write and what you're writing about. So honestly, I think in the end, it's more of a stats game than anything else, especially in high school. So I think class rank is huge for that. Do you have any advice for someone looking into the BSMD program? Yeah, absolutely. So I'm not the biggest fan of BSMD programs. A lot of people will tell you otherwise because it's more guaranteed, it's safer bet. And of course, nowadays they've made tremendous changes into the BSMD culture where it's a little more relaxed. It's easier to kind of get in. Or harder to get into the BSMD, but easier to get out of it and go to med school. It's also, a lot of schools don't require the MCAT. Some schools now say, hey, you can take a gap year, you don't have to go straight in. So these are all awesome things now that a lot of BSMD programs are doing. The reason I don't like it is that it kind of blindfolds you into thinking that medicine is the only option for you now. Right, so how many BSMD people do you know got out of the program knowing that actually medicine wasn't their passion, right? Not many, unless they got forced out or kicked out. And I just think at the age of 17 or 18, you really don't know, honestly, if medicine is for you. I mean, it sounds great. We know people are in it. We shadowed. We definitely want to do it. But I don't think that trueness and that pureness and that intention of doing medicine is truly there until you get 3, 4, 5 years under your belt to say, no, like, this is it. This is what I want to do. I shadowed more, like, I want to go out. I saw the non-glamorous side of it. That's what I want to pursue. Oftentimes as pre-med students, we don't get to see what medicine truly is like. And I can tell you that as an intern, like, it's more than what it is shadowing or getting clinical experience. There's a whole other side of it, the business side, the political side, the grind, the burnout. My first 2 weeks of intern year, I was doing close to 80, 85 hours a week. And the burnout doesn't happen in the hospital. The hospital is fine. You're going, you got to pay attention. It comes right when you get back home. When you get back home at 8:30, 9 p.m. and you say, damn, I got to do this all again tomorrow. What are my options? I either eat, I can work out, or I sleep. And sleep is probably the best one because you're going to have another 14, 15-hour day the next day. So these are kind of the things where you really have to be committed. And I don't think at 17 or 18, you truly know whether that life is for you or not, right? Things can change. The friends you meet, the people you meet, your journey through college. So for that reason, I think a 4-year, just going in as a 4-year undergrad is a better option, and then applying out. Because the thing is, if you're going to meet those requirements anyways as a BSMD, you're pretty much going to make those requirements for med school as well, for any other med school. So that's why I'm more against it. I know people who haven't gone through BSMD say, man, I wish I was through that. You'll just hear different things from different people, though. How does your schedule look like on the day-to-day? What do you do in your free time? Sure. So as an intern, my day-to-day, it really depends on what rotation I'm on. So because I'm a prelim, which means that I'm doing an intern year and then I'm not internal medicine, I go on to PM&R. So my first year is considered preliminary medicine year. So I'm basically internal medicine just for that 1 year. They have me on 2-week rotation. So I do 2 weeks of step-down unit, 2 weeks of allergy, 2 weeks of GI consult, and I'll do 4 weeks of medicine, 2 weeks of night float. So I'm kind of always just scrambling. So it really depends on the rotation. Like I said, my first 2 weeks were close to 80, 85-hour weeks. I would try my best to get a workout in, try my best to hang out with my wife. Sometimes it's tough. You just want to get back and just sleep on that bed. Allergy was a lot more chill right now. It's all outpatient. Some days I'm off because they only want fellows. So I have a lot more free time right now. And then I'm going on to GI consults, which will kind of be a mix, so I'll definitely be putting in hours. I'm not anywhere close to 80, but I'll be putting in hours and I'll be able to get back and spend some, free time working out, reading, doing the things I love. So it really depends on the rotation. But your intern year is definitely tough. There's a lot of medicine involved in it. So it's definitely a tough year because you're just learning a lot. The learning curve is steep, and there's just a lot to it. Okay. If you don't have the scores but the experience and the motivation, how can you explain that in an interview? Excuse me. So essentially, you explain that. You explain maybe why you don't have the scores. Was there something you did? Was there something, your study habits, whatever? But you talk about your strengths, right? You focus and you double down on your strengths. I have great experience because I'm a great communicator. I know how to network. I know the right people. I saw this during my experience. I saw this. And the motivation, right? So you talk about your why. All comes down to your why. Why medicine? Why this? Why that? There's a great book out there that I recommend all pre-meds reading. And again, I'm sorry for all the book references, but honestly, if you guys can read these books that I'm mentioning, you're going to get a lot out of it. It's called Start With Why by Simon Sinek. A lot of you guys might have heard it. He also has a TED Talk out there. But that book essentially tells you why the why is so important and why you have to write about it. Because it literally makes a better emotional connection with another person when you can talk about the why. It'll hit their center of the brain and they'll go, boom, wow, that makes so much more sense. I'd rather have you as a student than somebody who just told me about the what in medicine. So when people ask me for personal statement advice and I go through personal statement workshops with them, I'm always looking to dig deep, deep, deep into their why. And their personal statement is going to be 60% why, 30% of how they know they want to do medicine, what experience and stuff, and then 10% about what about medicine do you like, the Sherlock Holmes aspect of it, the investigative side, all those different kind of things. What do you say to someone who wants to go to med school but also wants a good family work relationship? Yeah, no, it's absolutely possible. I think those choices in terms of your lifestyle are going to depend on what residency you choose and stuff. So for instance, I didn't choose surgery because I just didn't want the lifestyle. I didn't want to wake up at 3:30 a.m., get to the hospital, round, come back late. I just didn't want that. I wanted something more of a better lifestyle, which is physical medicine and rehab. It's a very great lifestyle. And I wanted that because I am very entrepreneurial. I want to possibly work for maybe some other companies, maybe do consulting for other companies, things like that. So essentially you can still go into medicine based off your concern, but you're really going to choose what you want to do once you choose residency. May you share us a defining moment, a key experience in your career? Yeah. For me, it was honestly not getting into Temple Med School through the 7-year BSMD. I think, growing up, being an athlete, the only thing that would fuel my fire was kind of being cocky and just being like, yeah, I got this, whatever. And getting to that 7-year med program, I also took it lightly and I said, oh, I'm going to be a doctor, whatever. And once that all falls, it's kind of a wake-up call and saying man, no, I really have to work my tail off for this. If it's something that I want very badly, I got to work for it. I got to figure out what I can take advantage of, what my strengths are, what my weaknesses are, what I need to work on. So that was honestly the defining moment of my life so far, because it really opened my world into this mindset, growth mindset, and how I can improve. So I would say that. What would you say some benefits of being an osteopathic physician? Oh man, I love it. I'm so glad I went DO over MD, and no knock to anyone who's MD or going MD. But for me, going to PM&R, being a DO is everything, because using my hands helps so much with MSK, right? I can feel for things that other physicians and stuff might not be able to feel for. I can feel for knots in the back, when ribs are kind of out of place. I'm more tuned with the body using my hands. And then also having that holistic perspective, which again, osteopathic schools don't really teach that holistic perspective. That kind of just comes from the individual. But having that perspective and knowing that, hey, having a DO behind my name kind of means that, definitely helps. So what positive habits are helpful to develop before med school? Yeah, I think the biggest habit that you need to develop is how to add structure to your life. How do you fit the things that you want to do in your life on a day-to-day? Are you completing the things that you want to do? Are you productive? Are you efficient? Learning those things and learning how you can do those things through habit stacking, or understanding willpower, or understanding your strengths and weaknesses. Are you more of a night owl? Or are you more of a morning bird? So understanding those things are really, really going to help. So I think there's a book out there called Managing Oneself. So another book, but it's called Managing Oneself. It's this big. It's 60 pages. I have all these books up here somehow. I'll whip them out in some other TikToks or something if you guys want to follow their Instagram. But Managing Oneself by Peter Drucker talks about understanding your strengths and weaknesses, and what situations and how to adapt. And if you can understand that and understand yourself before going to med school, it'll make a difference. All right, there it is. Follow us TikTok. Yep. In your opinion, what is the future area of medical research that can revolutionize medicine in its entirety? Like how artificial intelligence and quantum computing are future focuses of computer science? Yeah. So there's a lot of things, right? For one, artificial intelligence, right? So we're seeing artificial intelligence being used in surgery as well as radiology, right? Those are kind of the two fields that we can now, the human eye can only see so much grayscale. But when you look at AI, they can see grayscale to the infinite amount, right? Another thing would be regenerative medicine, using stem cells, finding ways for the body to heal itself, right? So something like PRP, platelet-rich plasma. You take the blood out of my, like, let's say I have an injured knee. I take blood out of here, I spin it down until I only get platelets, and then I inject those platelets straight into my knee. And essentially, platelets have growth factors, right? So once those platelets kind of burst and the growth factors come in, those growth factors are going to help to reform and reshape that knee. So that's another thing that's really going to be upcoming. The third thing I can think of is personalized medicine and more epigenetics. So as functional medicine rises, as we get more data and research, we're starting to see a shift in terms of, under the bell kind of medicine where you fit the average or not, but more personalized, more looking at your genetics, looking at your microbiome, which is huge, and using more targeted therapy and really realizing, hey, patient A and patient B might have the same exact symptoms, same exact age, same exact upbringing, same exact everything, but because their microbiomes or something are different, we need to do 2 different therapies just to heal each one, right? So if I give aspirin to A and I give aspirin to B, maybe only it helps A but doesn't help B. Well, why is that, right? So I think that's the way the field is trending. What extracurricular activities did you do in high school? Sure. So I was track and field. I did basketball throughout middle school, and then into high school, I switched over to tennis. I was part of like Key Club, National Honor Society, student government. I think that's about it. I was really, really mainly into sports. For the 7-year BSMD program at USF, you have to choose biomedical sciences for the major. Would you suggest choosing a different program? Not necessarily. I mean, some programs are going to do that. Temple was the same way. And in that case, you kind of got to bite the bullet and just do it. But I would highly recommend minoring in something, if you have the time. But if you have the options for different programs, I mean, you really got to weigh the pros and cons. I wouldn't just just by whim say I want to go to a different program because I have the option to take a different major. I would really look at the pros and cons for that. What can I do as an undergraduate student to help stand out to med school admissions, such as hobbies or extracurriculars? Yeah. So basically something you're passionate about, right? So I think med schools are looking for impact. Think about it. If you were on a committee and you see all these applicants and you see all these hobbies, what are you looking for in these hobbies, right? Everyone's going to be part of AMSA. Everyone's going to be part of like AED or these frats that are healthcare related. Everyone's going to kind of have the same stuff, right? There can be multiple presidents. You can be secretary, but what does that all mean in the grand scheme of things, right? I would be someone looking for impact. What did you do with that position? What did you do with that leadership? Were you just a leader to be a leader, or did you actually take force and do something with that to improve the greater good of your club or of your school or something? So I'm always looking at impact. And that's why I say I think there's like 14 slots you can fill up for your app. You only honestly you can have 4 or 5, but as long as they're high impact, that's what's going to matter more. What is MSK? So MSK stands for musculoskeletal. Sorry. So yeah, I was abbreviating it the whole time, but essentially that's what it is, and that's what PM&R doctors also work with. Is it a good idea to have a BSN and join medical school? Yeah, I mean, if you don't think like nursing is going to be for you, and I'm sure as a nurse, you probably have more experience than a lot of pre-med students, excuse me, being in the hospital, and you think like, hey, I'd rather be the doctor instead of nurse, then absolutely. I mean, if it's your passion, you think it's something that can excel your career and your lifestyle and will make you happier, definitely. what are your socials? Okay, so yeah, you put them on there, Miguel. Thanks. This goes to what Arya said, but yeah, it is worth going for a BSN. Okay, perfect. Yep. This is more high school related, but did AP scores matter during your application to college? Yeah, so for me, they did because, again, I was applying to those 7-year programs, and I think I got in as well because I think I took 7 APs. So I think, you know, and the reason those APs helped is because if you get an A in them, it boosts your GPA in a weighted scale, and that helps your class rank. And in the end, I think class rank is that pure thing, that objective data that schools can look at and say, okay, well, this person was number 2, this person was 40, this person was 160, rather than just looking at a GPA, because that can be so, you know, variable based on the school. So, yeah, so I would definitely say AP scores probably, it did matter. And for me, it also helped out because I got out of Calc 1, Calc 2 in college, which, you know, everyone hates Calc, I'm pretty sure. And I ended up taking Calc 3 in college because it was easier, easy A. And then I got out of like Orgo Lab, I got out of one of the chem labs. So it really helped with me making my schedule and making myself having an easier schedule in college. So I think that's where APs really helped me out. Yeah.
So I have another question. So I know you were recommending like to take another major that's not like STEM related. Like, at least for me, I do have a lot of STEM related extracurriculars. So how would I like convince undergraduate admissions offices like why I'd be going into, say, like philosophy in place of like biology or something?
So I guess my question to you is, you can't just switch like randomly? You have to get approval from your undergrad?
No, just kind of like, I'm a rising senior, so it's like if I were to apply for like philosophy major, even though like I do like science full and I'm doing like another medical mentorship, like how do I say that like I want to choose this undergraduate option?
Right, I'm guessing?
Yeah.
Okay. So I don't know if it'll depend, honestly, but if they ask you, you tell them the truth, and you kind of say what I kind of just said, is that you're thinking pre-med, you're going to be doing sciences for the rest of your life, like literally for the rest of your life in the next 50 years. And none of that stuff is going to help you that you learn. Like a bio major will not help you at all once you're in med school. None of those majors do. So it's honestly, I would word it in a sense that I want to diversify my knowledge. Like I'm still going to join STEM clubs and still be pre-med and be a pre-med minor, but at least I have the option now to explore different things, get involved with different activities, meet different friend groups that are interested in different backgrounds. I think that is the beauty of college, honestly, is kind of having that widespread network and everything's at your fingertips. So that's honestly the way I would kind of word it to the undergrad.
Okay, thank you.
Yeah.
Any more questions, guys?
Yeah, feel free, guys, shoot away. More than happy to answer anything. So.
Anything else? No.
I am, if I can just plug this in right here, I am doing a giveaway on my Instagram for secondary application essays where I'll edit them, I'll look at them. You don't have to be applying this cycle. You can be applying in like 3-4 years from now. It'll still hold valid. So if you are interested in that, you can go ahead and join that or enter that contest on my Instagram. I think it's like the 3rd post. So.
Well, I think that wraps up everything, Mr. Dr. Shah. Thank you for your wonderful talk, and it was great. You know, we really learned a lot, and yeah, we really appreciate it.
Yeah, absolutely. Again, thank you. Thanks for having me on here. And again, during this whole COVID thing, I know things are crazy. Also, last thing that I forgot to bring up, if you guys are looking for clinical like cases, if you go in my Instagram TV, I have about 15 or 20 hours worth of cases where it's like each one's about an hour long, and I'm kind of just lecturing and just teaching you guys in terms of subjective, objective assessment of plan, and we go through it step by step. So, and it counts as a medical school activity. So if you watch those, you can put it on your med school apps. Yeah. So.
Yeah. All right. Thank you, Dr. Shaw. Really appreciate it.
Appreciate it, guys. Thank you again for having me on here.
Thank you.
Thank you.
Reach out to me if you have any questions.
Yeah. All right.
Thank you.